Hello, everyone, and welcome to another episode of Finding the Unicorn in You. Today, I have another special guest who is the owner of Golden State Hospice and Palliative Care, who got his medical degree from the Universidad Autónoma de Guadalajara and a master's in healthcare administration from the University of Southern California. His company addresses population health management by bridging the gap with populations, improving the experience of care, improving the health of populations, and reducing per capita costs of healthcare, as well as building strong relationships with local businesses. So without further ado, I have Dr. Arash Shamsian.
Hi, Jaime. Thank you for having me come. It's actually Golden Gate Hospice Care, not Golden State. There is another hospice that's that, and there's a huge difference. So this hospice is more of a community-based hospice and has a lot of more resources. And in addition, we have contracts with the LA County and the state hospitals. So it's a huge difference than
Got it.
the other one.
Sorry, thanks for the correction. So Golden Gate Hospice. Perfect. So why don't you tell us, and since we're in the topic, why don't you tell us a little bit about why you started this and how you went into this career?
So my history goes from going to med school, then to training, and then I worked at Cedars-Sinai Medical Center. When I was at Cedars, all of the fellow doctors I was working with were older, much older, like 70s and 80s. And so our department manager, you're really young. Why don't you go get a master's degree? And I was like, okay. But usually I listen to administrators or people that are around me because I'm new to the field of medicine. It was just, it's like they probably have more experience. They know what's going on. There's no harm. So I signed up with USC, got my master's in healthcare administration, which is technically an MBA in healthcare. And that taught me a whole lot. Taught me about how hospitals are run, how the healthcare system works, how the insurance system works, and the concept of having a business, which they don't teach you in med school. And so it was literally looking at everything in a different perspective and putting both sides together and understanding what needs to have for a business. Once that was completed, I basically started to shift my thought process to what Medicare and the healthcare system is going towards, which is moving healthcare outside of the hospital to auxiliary services such as home health and hospice and all these other services that they have to reduce the cost of healthcare within the system. So when I started looking to start a business, I was more interested in home health. And when I'm looking for businesses and working with business brokers, everybody hears hospice. And for me, it was like, what are you talking about? I don't know what hospice is. Like we've learned this stuff is in palliative care and hospice, but in California, there is no hospice center, which kind of made it difficult when somebody's like, here's hospice and there's no facility. There's nothing like a traditional hospice facility that people are looking for. So eventually I got introduced to a company and helped manage a lot of patients, over 400 patients with another doctor. And that doctor did like the training and fellowship training for me. I'm glad that you're here. You can help me monitor these 400 patients. With your background, you're very good in helping me with the patient management. And plus, my purpose was more for the chief operations officer because of the business aspect. So during that time period where I was immersed in what hospice is and learning and getting trained, I realized a lot of the pitfalls. Even though just because you're a big business and corporation, it doesn't mean that everything is running smoothly. From that, it really resonated with me that the underserved community is being taken advantage of. and they're not being served as well because of the lack of education, the language barrier, understanding what hospice is, a lot of the misconception of what insurances cover, what insurance doesn't cover, maximum utilization of the insurances, like how do you bring more services just because you're in hospice. So all of that passion grew into wanting to open up a community-based hospice, which was really focused for the underserved community. And traditionally, or the original plan was for the Latino Hispanic community to help educate them, bridge that gap. And with that meant was having a full Spanish speaking staff, having consent in Spanish, brochures in Spanish, content in Spanish, making sure people would understand, at least in Spanish, that what hospice is. And the funny part is that in Spanish, hospice doesn't exist. That word doesn't exist. So it's using the proper terminology. And that kind of did help a lot of families try to connect and understand what it means. But then again, there's still a lot of stigma that's going on and a lot of issues. And I don't know if there's enough time to go over those topics, like fall into what hospice and palliative care is.
So I know that I know hospice as I worked on it before, like in similar fields. But if you can define just hospice in itself so that the listeners can understand, like, how, how would you define it?
Hospice is really about quality of life. It means that if you have a chronic illness that you're not doing well, this is meant to bring you hospital grade services to the home. It was designed by Medicare, and the point of not really labeling you as terminal, it's been really referred to as people who have terminal uh, diseases, but it's really focused on chronic illnesses because it's trying to take the weight of having families going to the emergency room and using it as urgent care.
Yeah.
So that's the opportunity where with us, at least at Golden Gate Hospice, you can have that chance to talk with me and say, this is what's going on. What do you think is the best answer? Because not every single time hospice is the right answer. There are different options. There are home health. There are palliative cares options. It's again having conversations with families to see what they want and what their expectations are. It becomes a lot difficult in to simplify things for families that who need hospice and they don't want hospice and they just say, I need palliative care. And palliative care, again, literally the literal translation of palliative care is pain management, which is part of hospice care. And hospice care is more of a supportive care. I label it as supportive care because it's more than just medical services. It's more than just having a nurse. It's more than having a doctor. It's about bringing in social workers, having home health aid, bringing respite care, which means time and support for the family, being to have bereavement or counseling service or stress management services for the caretakers. And with our hospice, because we are community based hospice, we're going above and beyond and we implement end of life doulas, and which they're spiritual healers that come in, help families with the transition, help patients with the transition, try to understand what's going on. So that's the extra added bonus that we've implemented into our program.
Okay, that makes sense. And it's important work. I want to think one of the things that, at least for me, when I first heard of hospice, I automatically assumed that it was for elderly individuals, but that's not the case, correct?
Yeah, that's not the case. Not everybody who's elderly is has a chronic illness. You might be, for example, 28 years old and have HIV. Again, that doesn't mean you're dying from HIV AIDS. There are complications that come from it, which qualify you to be in hospice. And that, again, that's where this hospice was designed for. It's really for the underserved community. Another example is because we work with the Los Angeles LGBT community, it's about not giving that stigma and having the cultural competency to let people know just because whatever decisions you made in life, whatever background you have, that doesn't mean you don't deserve that support. Even
Mhm.
if you're dying, you shouldn't feel like you're dying alone. You should have that extra support that's coming from the hospice, the the networking that we do to get you the support that you need for the family and the patient to help you with planning things, advanced directives, the mortuaries, having the social worker help you. So there's a lot of things that can happen. But the purpose again is I don't want families to feel just because of your background, you're not able to get support. And the same thing is with insurance. It doesn't matter if you have Medicare, Medi-Cal, or PPO plans like Blue Shield. That's where this whole conversation comes in is you don't have to be a senior. You can literally be 40, 50 years old and have cancer and
Mhm.
not doing well. So the idea of equating hospice to seniors is not really relevant in today's society.
Yeah, it's good, and I wanted to mention that because that's one of the things that when I used to work in respite care. So, it was for individuals who it was either the elderly or people who just needed help or that just needed somebody there, a caretaker or kids with developmental disabilities, and that's the respite care that I dabbled into, and a lot of the coworkers and people were like, "Oh, yeah, either they're young children or really old people," and I was like, "No, respite care can be, like, different, same thing as hospice." There's we have to get out of the scope because the more we categorize these things as niches for specific generations or populations, we think that we may not qualify if we go through something like that.
That's true. And that's one of the challenges again with talking with families or letting the community know what hospice is. And every time right now, the big idea between hospice means for the community is that means death
Mm.
because they compare us to Vitas, which is one of the biggest hospice corporations. And they say every time we've heard that they put our loved ones in Vitas, they usually pass away within 2 weeks.
Oh, wow.
And so again, that shift, I'm trying to take that shift away because it's not about death. It's about rebranding that whole idea of good quality of care, quality of life, right? Just because you're in hospice, it doesn't mean you can't go see your primary care. Just because you're in hospice, it doesn't mean you can't go to the emergency room, right? Just because you're in a hospice, that doesn't mean if you have a wound, we're not going to take care of it. Just because you're in hospice and you're coughing, that doesn't mean you can't get labs and you can't have cultures taken and get the right medications for it. These ideas of giving up on your loved ones, the challenge that we're
Yeah.
facing because people think hospice means giving up on your loved ones. And honestly, I don't think that should be the answer because if we can treat someone for something very simple, like an upper respiratory infection or a urinary tract infection, why not? Why are you giving up on somebody's life just because of a simple thing? If it's a more complex, then we can have that discussion. If they have cancer and they need chemotherapy or radiation, that's fine. You can try it. You don't have to be in hospice. But if you've tried it multiple times, you have to understand the side effects that come with it. Are they willing to go through another round of chemo or radiation? And another balance has always been with physicians because they're thinking if I put them in hospice, I won't be able to see them as a physician, which again is not true. And that question comes up again, like a good example is with radiation therapy. Radiation therapy is not meant to cure, but it's meant to help take away the pain, which is would you rather go through that or just take pain medications and have more quality of life? Because with radiation, there comes a whole lot of side effects. And
Yeah.
it's that balance that we try to talk with families. And again, I'm not here to say everybody who's sick needs hospice. We need to have that conversation and to the conversation of what the family wants, what the expectations are. Do they understand the chronic illnesses that these are not going to get better, like
Yes.
Alzheimer's. It's a progressive disease, or Parkinson's. It's not something where I can just give you a medication and you're going to feel better, or that disease is going to disappear. And that's where hospice can come in, is you have a chronic illness that's progressing, and part of the progression or downfall is literally what you will see, them not eating and losing balance or falling down. So we have those discussions with families to help normalize the situation.
Yeah, that makes sense. And it's important work that you're doing. And I can probably go into I have so many questions, but I do want to go into my next section. Which is like what are you had the choice of doing this profession under someone else, but you decided to do it as your own business. What led you to make that decision and what inspired you to make that big step? Because that's something that most of the population won't even dare to do.
So one of it is, part of it, it was the guilt, right? Corporation, other businesses doing something, and you're like, I can do this better. And another part of it is, if they can do it, why can't I do it? And that's where that fire or passion comes from. It's, you are not addressing these issues that families need because you are a corporation and you've been stubborn into following your own certain procedures. If it's not broken, why fix it? And for me, it's more of dynamics. It's a cultural shift and change. Everything is eventually going to change, and you have to either change your dynamics, change your policies to meet the demands, or you're never going to end up growing. And as a person, like, I'm always in that stage of growing and trying to get better and trying to learn. It's not saying that I know everything. I'm like the perfect person, or, I can do this by myself. And at this stage, I still do have other physicians, other people that I reach out to for consulting. It's just, imagine there's a lot of scenarios that come up. It's, everybody doesn't have exposure to these scenarios. And for the doctors that I work with, they're like, this is the first time that I have encountered this, but I'm happy, I'm good, but we can adjust and adapt. And it's just like thinking, like, if you're a doctor, right? If you've been trained and you've gone through all this training, and then one day you're doing surgery and something happens, if you've never had that problem happen, you have to have the ability to think on the spot and not say, because I've never seen it, I don't know what to do, and just run away. And that's the same mentality that I'm using to move forward with this business.
Yeah, I like that. And then one thing that you did say is that you like reach out for peer support with other people. And I think that's one of the things that people stress out the most is that you are truly doing this alone, but you really aren't. There's a community of other people that are also business owners that are also willing to help you out because they've gone through the same struggles.
That leads to the next question, I guess, that you had in mind. It's, as a business owner, what do I do to get support?
Mm,
I do have, or I do sign up for mentorships. And usually it's funny because a lot of these mentorships that are free from the county and other programs and colleges, they've never experienced someone like me that's, I'm willing to give you feedback, or I'm here to help you. It's the same thing with my marketing team, right? When I hire a marketing team, everybody as a business, it's like, I don't know what to do. You, as the marketing person, has to plan and do Google and do this. And they're like, what am I going to market? I don't have material. I don't know what to do. And for me, I can tell you what to do. I will give you enough content, but I need you to help me because I'm not a marketing person. Ironically, my marketing person has tons and tons of content that I always dump on them and be like, here's the current events, here's news. Let's make reels about this. The new actors talking about colon cancer. Let's talk about that. Let's have vlogs. Let's start building this stuff. And it really connects with Google search engine optimization, and people are searching for something else, and then they can read about this and understand how it connects. So that's where that comes in. And with the mentoring part, I usually talk with them because of my challenges, like the challenges that I have as a business. I reach out to them and say, what are your thoughts? What do you think is good? What is that? And what is not? Some mentors have been good, give some ideas. Some mentors have pushed back and given some crazy responses where I don't listen to them and I use my own judgment. Just because I get a mentor doesn't mean that I have to listen to them. Everybody's advice is it's just an advice. You have to translate it and not take it literally. For example, like when I spoke with a mentor and I told him like I'm having difficulty with people connecting or searching for me. And he's like, well, why don't you change your name? Change your business name. And I listened, but then like my response was like, why would I change my branding or who I am? It's not like Nike changes their name because nobody knows who they are. You're misunderstanding the point where you have to equate resolutions or responses that equates to the name, not the name. Like your name doesn't define who you are. Just because somebody named you Alex or somebody named you Barbara, that doesn't define who you are, right? You are going to define who you are by what you do, how you respond. And that's my idea, not the name, right? That wasn't the right answer. So that's what I use for mentorship. And sometimes when I talk with my mentors, I tell them like, this is what I'm doing and this is what I'm doing. And they're like, wow, you, they're speechless. They're like, you've done more than I would have thought about. And you're giving me ideas. And I didn't realize this. And I'm just like, and so that's how I get that extra support that I need for the business. If I don't know anything, I usually ask for mentors to guide me.
Yeah, I actually do the same thing as well. So that's like the biggest way to manage my stress is try not to do it all on your own. Build a community and then reach out for help because the same type of feedback is it's like everything's in here and sometimes it's hard to process all of those thoughts. You have to get it out and let some bounce it off of someone.
Understandable. And then also the things with the mentors are like, if you have ideas or you want things to get done, but sometimes you don't know how to connect.
Mhm.
And they're like, I know this person, you can talk to them, and this person will guide you on who to talk to or what to do. And that's been helpful too. It's not, I don't look at the mentorship as like a one way, like you giving me advice, but it's also an opportunity to see how much connections they have and how much support you can get. And that's helped a lot.
No, yeah. And this kind of goes into my next question. What advice do you have for other people that they can do to enhance their personal development or their career? Is there anything that you think that they should do that should prioritize over the other?
Personal development and careers are two different things. Personal development is more focused on what you envision or what you want. Also not listening to people's advice. Someone will say, you're not good enough to be a doctor or you're not good enough to be this. And that's their opinion. That doesn't mean you can't do it. Personal development for me would be like if you want to do something and people tell you no, then you need to figure out another way of approaching it till you get an yes. And that will help not only your self confidence, but also give you the boost of growth, self growth. And the other aspect of like business development is really having a business plan, right? You have to have a mission, you have to have a vision, and then also think about growth. And part of that business plan is that you already visioned something, but there's going to always be challenges that come through. And that's where that change, that philosophy comes in. How do you adapt to the change? How do you move forward or how do you figure to solve the problem? A lot of businesses don't do change. They don't reassess, stop and say, hey, this is not working. What else can I do? And that's where a lot of businesses fall through is because the lack of wanting to change. They're thinking that just because another business did it, it should work for me. And that's not always true. It's if you have a pizza shop You can't really say, I'm better and I'm going to do the same things as the other pizza shop is doing. Your philosophy should be, what makes this pizza shop different? Why should people come here? What's the value? And that's the same thing that I do. It's like my collaboration with other businesses and relationships is bringing the extra support for families that are not covered under hospice, that's not covered under the insurance umbrella, but be able to utilize a lot of the resources. And that's what makes us different. I'm not here to say, I want you to come to my hospice. I'm not trying to force people. There's over 2,000 hospices. Go ahead, be my guest, go to anyone that you want. I'm just telling you what I offer, whether you like it or you don't like it, that's your decision. I'm not, and that's the same response I have with hospitals, right? I'm not here to compete with other hospices or businesses. I offer a unique set of tools that will benefit not only you as like another business or a hospital, whether you take advantage of that's your decision.
That makes sense. And it's all about there's plenty of people out there that have the same conditions that are going to need your help. And not it's not always going to be like we're going to run out of clients. And I think that mentality we have to put aside, and it's an older mentality of a dog eat dog world. We can work together, we can collaborate. People of the same agencies can be working together, share, referral. And what if like they like one provider over the other? Not don't take that personal and then on to the next. There's enough to share around. And I think the more we look in that collaborative, supportive, helping mentality, I think the better we are as business owners.
And also knowing your limitations. Sometimes I might not have the resources or I can meet your limitations. So being transparent is also good as a business owner, not just because thinking I need it and I'm going to lose it or whatever. You have to adapt. If that's your limitation, that's where this change mentality comes in. This is my limitation. If I don't want this to be my limiting factor, how do I change? How do I adapt? Do not have that as my limiting factor.
Correct. Yeah. And then, like you said, every single business has, and anyways, every single person has something unique about them that is different from the other. Your services are not going to be exactly identical as the other ones. There's always something different.
Correct. And that's our marketing philosophy. It's there are other hospices, but this is what I offer. This is the unique opportunity. And it's been helpful. I've had people call and say, my loved one is in this hospice, but I've read that you do this and I want this.
Mm.
I want to be with you. Okay. That's wonderful. It shouldn't feel like I'm fighting for clients. It shouldn't feel like that. It should be something where people are like, I want you because I know the value that you have.
Yes.
And that's makes me feel proud. And it makes the people or the organizations that I work with also proud. It's
Mhm.
supposed to give that confidence of yes, and also my nurses and staff members. It makes them feel like I'm very proud to work in this business. And that's what I'm trying to give. I want my nurses, I want the staff to be happy and say, wow, this is a hospice that's recognized by Los Angeles County. How many other hospices in California are there that's recognized? Only a handful. That's a recognition in itself, right? Cedar Sinai Medical Center wanting to work with us and do marketing and collaborating. How many other hospices does Cedar Sinai want to work with, right? It's like these things should give enough pride to the staff and the nurses. And that's the motivating factor of why I want for people to work for me, not because it's just another job, right? I have nurses that are like, I need a job. That's fine. There's a lot of opportunities out there, but I want someone I understand the value of your company and I'm proud to be part of the company.
I think you're doing an amazing job by doing that and treating people right, being able to be more collaborative, making an open environment. I think that's what it's all about. And it's drawing in the right people, right staff, right providers, right businesses to collaborate with you.
It helps on a lot of ways. If they're proud to be part of the company and they're motivated, they help. It's
Mhm.
easier to help. And people who just care about working unfortunately, they will make my life harder because they're like focused on money and then they're like, I don't care. They don't do their work. And it's this philosophy of, I just want to get paid for not doing work. It's painful, especially for a small business. If it was like a bigger corporation, then yes, I would have the luxury to play around a little bit because there's enough cash flow. But when you're tooth and nail for making really, $1 or $2,000 a month because you're giving all these resources and you're putting things together, I just don't have time for someone I want money, but I don't want to do the work. And they're getting paid well too, which is the irony behind it. It's not like they're getting paid 15, $20 an hour. They're literally getting paid really good
Yeah.
money for their time. And as a respect, honestly, I want that respect back. I'm paying you substantially well. Please give me that respect to help me. Don't make me come after you and say, where's your notes? How come you're not doing this? Why aren't you talking to the patients?
As long as you respect them, they'll respect you. And it really does help with employee retention and happiness, satisfaction, all of that stuff.
Correct.
So we are at the time where I'm going to ask you the last question, which is the premise of the podcast. So the unicorn lesson. So what is the most valuable lesson that you've learned in your career that you believe everyone should know to help them out?
The most valuable lesson that I learned in my career is, and that means that even though you might not know something, is to talk with other people. Say, I want to solve this. What do you think? Just talking and having conversations might give you ideas, things that you've never thought about. They might not know the answer, which is fine. If you're not asking for answers, sometimes you're asking someone like, hey, what do you think I should do? But the idea behind it is not like, what do you think I should do? That's a good question. It's just to give you thought processes. Maybe they see things in a different way. And that's why we're so unique, is to have different perspectives and for you as a person to put those perspectives together and make a conclusion.
I think a lot of us end up doubting ourselves and we feel that we haven't, like we're imposters or that imposter syndrome kicks in and we start comparing ourselves to other people and what they do. And I think we start losing that sense of self. So it's like stick true to yourself, try to do what you do best and let other people do what they do. Don't compare yourself.
Yeah, that's also been a very big pitfall for everyone. It's you always comparing yourself to someone else. It's like someone else is successful. That doesn't mean you can't be. You're going probably through a hard time. You just have to figure out how you can be successful, whether talking to people and saying, I'm having difficulties marketing. That's basically what I'm doing. That's why I have those mentors. I talk with them and say, I already have a marketing team, but it's not getting traction. Like people are not calling it. There's not a lot of people who are interested in it. What am I doing wrong? What's so different about it? What do I have to do? What are your thoughts? And so we have these open conversations. Sometimes just talking out loud with them gives me ideas. Sometimes they'll say, that's a good idea. You should do an action plan and follow up and keep yourself accountable. Because as an owner, you might have a lot of ideas, but you have to also make the performance values or things that you're following to say, did I reach my goal? Am I reaching that goal? And if you don't, what do you have to do? Who do you can talk to? Maybe you want something that you can't achieve. That doesn't mean you can't find somebody who knows somebody and who can help you. It's just getting outside of your shell. That's the bottom line. It's like you are who you are, find the core self and try to get answers from people and getting support.
This has been such an amazing conversation, and you've given a lot of good nuggets for listeners. If you missed all of that, just go back, re-listen, take notes. But also, at the end of after the show, if you go to my website at Raygoza, rainbowcareercoaching.com, go to the Unicorn Wall of Fame. You'll see a summary of today's podcast on there, and you'll see Dr. Arash on there with the rest of our guests that have popped in. One last reminder, guests for listeners, episodes come out every Friday at 7 a.m. So don't forget to tune in and don't forget to apply the unicorn lesson that Dr. Arash shared today with us. Any last words before we finish the podcast?
Hopefully, everybody in the community can work together instead of thinking about being independent. I think that's really been missing from the, our current culture and society.
Mhm.
And that, I mean, we all can help each other. I mean, if you just think about it, doesn't mean just because you have a business, that's one thing. If you have a restaurant, you can work with local farmers and help each other. There's so many different ways to bring that added value.
I completely agree. Together we thrive.
Correct.
Thank you so much, and I hope everyone has a fantastic day, and until next week.
All right. Thank you.